Hi everyone, it's Dr. Hicks with the USMLE Master System. And today I'd like to address questions about psychopharmacology. So these are questions that I received asking about how to treat either depression, mania, or psychosis. So let's kind of address like some of the symptoms first. So if you're depressed, we kind of manage depression using the acronym SIGECAPS. SIGECAPS. The first S stands for suicidal. The I stands for loss of interest. G, guilty feelings. E, decreased energy. Then there's C for lack of concentration. The A, changes in appetite. P, psychomotor agitation. And the last S, changes in sleep. So, how do you manage depression? So, first line medication are our SSRIs, our serotonin specific reuptake inhibitors. So, those are like our fluoxetine, our Prozac that we give patients to treat depressive symptoms. So you have to warn your patients about the side effects prior to beginning because you don't want to risk them stopping your medications. So when they come in and they still have the same symptoms and you're like, what's going on? And they'll be like, well, I stopped taking it because I started having sexual side effects, like sexual erectile dysfunctions. So make sure that you warn them beforehand so they can be prepared so they won't stop. Second line after our SSRIs are our TCAs, like amitriptyline and nortriptyline. So make sure that you really pay attention, especially in the elderly population, because you have to pay attention to any type of cardio or respiratory changes. And so you're just very careful about the elderly, okay? And warn them about any type of fall risk. Second, so after our SSRIs and our TCAs, then our third line are our MAOIs like salicyline. So make sure you warn them of any tyramine reaction. So don't take SSRIs as well as MAOIs at the same time because you're going to have a buildup of serotonin. And make sure that they stay away from like aged cheese and wines while they're on it because that'll lead to a tyramine effect. Then after that, you have our SNRIs. So just be careful when you are prescribing these medications. Just follow the protocol. SSRIs, TCAs, MAOIs, and SNRIs. Okay? Then you want to treat things like our bipolar disorder, in which you want to give things like lithium as well as Depakote for like mood disturbances. So then you want to follow the acronym DIG fast. Easily distracted, changes in interest or increased activities. And then you have our grandiosity, flight of ideas, activities such as shopping sprees. Oh my gosh, I spent thousands of dollars on phone cases. So just pay attention to those as well as when they present with a very talkative and pressured speech where you just can't get a word in edgewise while they're speaking. Then our psychosis. These are our people who are having auditory, visual, as well as tactile hallucinations. They're hearing voices that are not their own, or they're seeing things that other people may not see, such as shadows or dead people. And then there's tactile hallucinations where the patients are saying they feel like they have bugs crawling on their skin, but when they look down, there's nothing there. So then you want to treat them with antipsychotics. We have our typical antipsychotics such as haloperidol, which is one of the oldest medications that are out there. But at the same time, you want to warn them of EPS symptoms such as tardive dyskinesia, which is irreversible. So then if you're moving away from our typical antipsychotics, you want to move to atypical such as risperidone or olanzapine. Be careful with the weight gain. And then you warn them that it's a possibility that you could become pre-diabetic or diabetic on these medications. So that's how we manage our psychotic patients. So we talked about our depressive symptoms, our manic symptoms, and our psychotic symptoms. Those are the most commonly questions that I got this week. So keep those questions coming. They're very good, very interesting, and I like to address them all. So whenever you have any questions, please send them to me at usmlemastersystem@gmail.com, or check out my website and you can send me messages there at usmlemastersystem.net as well as usmlemastersystem.org. It's nice speaking with you. Again, I'm Dr. Hicks with USMLE Master System, and I'll talk with you again next week. Have a great week. Bye.